Is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is Friday, October 29th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the monthly webinars with Bernie Simons, the Deputy Secretary for DDA. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There's one handout for the webinar, and you can find it in the handout section in the panel to the right. They can also be emailed upon request. We will be recording the webinar and post the YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon. Can you hear me okay, Don?
Yes.
Well, welcome everybody. Hopefully you're not getting too bad weather. We know it's supposed to be like this through the end of the day, and I believe it's supposed to rain tomorrow. So hopefully everybody stays safe. Again, I want to thank everybody for their continued support and attending these webinars, especially since we've gone to monthly. And I just want you to know that the department and DDA is proud of all of the work that you've done in the past 19 months and keeping people with developmental disabilities safe. I also appreciate the many families who have stepped up to provide the supports and services, and whether they be in person or virtual. And I remain committed to building off what we have learned as we move forward in the future. Excuse me. And so as we do this, we will give some updates on COVID as we move into the next. Next slide, Donna. Thank you. So again, our highest priority is health and safety and the well-being of everybody, family, staff, providers, etc. And that the DDA is committed to transparency with all of our stakeholders. And I want to thank again for your continued support for being here on these webinars, etc. Next slide. So recently there's been the Council of Quality Leadership, etc., who have worked around direct support workforce and concerns. And, we've been working collaboratively with the DD Coalition and NACS and other stakeholders about how we can support everybody in this difficult time and the important work that needs to be done. And we know that it wasn't wonderful before the pandemic, and we know we've lost some staff in the pandemic and, etc. I also want to recognize Seek, who's one of our DDA providers and who was a winner in the Administration on Community Living DSP Challenge. And the link is on here where it says DSP Training to Program. And we look forward again to collaborating with everybody about how we can improve our workforce and get more people back to work. Next slide, please. So everybody knows that this is National Disability Employment Awareness Month. It was recognized. We know that the theme this year was America's Recovery Powered by Inclusion. And this does reflect the importance to ensure that all people with disabilities have access to employment, community involvement during the economic recovery, hopefully, that we're getting into much better with the post-pandemic as we move forward. I'd also like to thank all of the providers who have worked with us throughout the years on the Maryland Outcome Employment Data Project. That's supported by the Institute of Community Inclusion at UMass Boston, which is one of the projects of national significance designated by ACL. It shows that, people are looking to get into competitive integrated jobs, even during the time of the pandemic. And, the data that we collected in May of 2021 showed an increase of 3%, or about 250 people who actually got competitive jobs. And 16 new individuals contracted jobs, was up prior to the pandemic. And that we know that the employment rate is about 22%, which is an increase of 3% over our previous data that we did in October 2020. So, a big thank you for individuals who say, I want a job, working with providers, job coaches, job developers, everybody, so that, you can live out your dream and have a job that you want and feel satisfied and have a lot of self-respect, going to work every day and feeling good and being able to earn some money and buy the things that you want to buy. So I think it's good. I think it's a win-win for everybody. And, as we move forward, we'll continue obviously with this. We have learned a lot about employment technology. And, as I said earlier, we'll continue to stay on that path as we move forward, as more people want jobs, is what we've learned from technology during the pandemic, people working remote, et cetera. So we will continue to support this engagement and have this discussion about integrated employment as we move forward. Okay, so obviously this is what the governor did with the Citation Proclamation, and I want to thank the Department of Disabilities, DOORS, the Employment State Leadership Team for collaborating on all of this. And obviously we have a month of dedication that's shown supports, and that we did become an employment first state, and had a lot of providers work on all of that and do a lot of significant work on everything we wanted to do moving forward throughout the past, probably, I think we started that probably about 6 years ago. And a lot of time was put into that volunteer time by providers and families and individuals about how we would make Maryland an employment first state. Next slide, please. So in 2015, we issued a transformation communication that basically talked about what we wanted to do and having a vision that was flexible, person-centered, family-oriented, et cetera. And that we take a look at our focus areas, around employment, housing, supporting families, et cetera. And we are adding technology to that, since we've learned more about technology. It was not on the forefront of what we were doing back in 2015. So again, I think if you look at our website with the circle, it basically has all of these, again, housing, employment, self-direction, extremely important, as well as self-advocacy, et cetera. So, we will continue to move forward with that. And obviously in this next year, we will be, as you see through these timelines, conducting the rate study, so that we have, and we've been doing this for a while now. So obviously we need to get to the finish line with the rate study, et cetera, and where we are moving forward. And, obviously in here is also the Ken Capone bill, which basically eliminated the 14C certificates that allowed people to be paid some minimum wage, and we think that the Department of Disabilities and DDA did collaborate for the last 4 years in assisting agencies who stepped up and, voluntarily said, I'm not going to do a 14C certificate anymore. So I think it's really good. It's basically how we got into, the Department of Disabilities and DDA working with the government accountability report on a sub-minimum wage, et cetera. And, we are committed to continue with this, especially knowing that we've got to come into compliance with the community settings rule by 2023. And, again, I congratulate everybody who's moving forward with that as we continue to move forward with that obligation that CMS put out in 2014 with a 5-year glide path. And then obviously with the pandemic and other issues going on, it's been extended to 2013. Next slide, please. So early in October, we started dealing with unwinding, and actually we started before then, but I just want to highlight the 2 areas that were of concern that we made changes, we, meaning DDA and Medicaid through to CMS, about the waiver training. We had heard that, I think it was about October 14th was the date when training requirements for family members would have ended, and we've extended that obviously until December 31st. And also there were some concerns with the number of isolation days that people had and what those rates were, and that's also been extended. So we obviously listened. We, meaning the Department of Health as well as Department of Disabilities, have been meeting and working closely with the DD Coalition on Appendix K and unwinding. We've been meeting, I believe, since August. And obviously we will continue to meet and see where we are with the unwinding and how providers are positioning themselves to reopen and what that opening actually looks like. So again, with this collaboration with the DD Coalition, I want to thank them for all of the meetings that we've all collectively attended. Next slide. Thank you. So obviously there's a link up here of what we did with FAQs and the most current about the unwinding. I won't go through this. You can click on it and read. Thank you. And again, you can see this, what's new about DDA is where it is. And obviously, if people have not getting alerts, please join our mailing list. You can see on there what that looks like. Next slide. So this is, just some questions that have come up and some answers. I'm not gonna bore people with me reading this. I mean, but it's, how will DD handle, approval of PCPs with the date? You'll see what our goal is and, what we've done with CCS groups, et cetera. And, we recommend that the providers work with the person and the teams. Extremely important to have team process, as we all know. And, this can be done with the coordination with any upcoming annual plan and what we need to do. And we want to reflect that the service model for the participants is also in the IS service implementation plan, et cetera. So again, this is extremely important in how we do this. Next slide. And so again, what's the need for providers to continue to offer some of the service virtually after the 31st? Does it mean, that they need to do a program service plan, et cetera? And again, if you see detail memo 3 and the DDA's waiver amendment on virtual supports from February 16th, 2021, you will see where that is with the Appendix K, etc. And so, again, I would just ask people who are attending this, and if you know somebody who really needs to get this information also, to please share it with them. Thank you. Next slide. So this is about how we'll provide as bill participants the day programs that are still not open ones, Appendix K. And obviously, remember Amendment 3, dedicated support, shared hours, add-ons, etc., to meet the needs as adjustments as we continue to move forward. Next slide. So what happens longer term when a person wants virtual supports? Again, meaningful day virtual supports and residential supports cannot be provided at the same time. So we need to make sure that there's dedicated supports prior to meaningful day supports, etc. So again, this is guidance on how we're updating and unwinding Appendix K. Next slide. So this is about the LTSS and obviously expansion. And, everybody knows that we did an early pilot. And then I think we've had some people obviously do webinars with us here and have discussion about what the experiences are. So we're taking the learnings from what we've seen in LTSS Maryland, and it's a Medicaid platform, and DDA is one module, and then we will continue to figure out how we're moving from PCIS2 to the LTSS Maryland, and we know we have 5 providers that are 100% in as what we called early adopters, and I believe we had 2 of them do a presentation a while ago about what their experience was. So as the department and DDA, when I say Department of Health and DDA, is planning an expansion in a calendar year, as you see in the last bullet. So we'll continue to move forward. We've got to complete the rate study first, and then continue where we are with implementation strategies as we move forward. So next slide. So this is about the ARPA funds, and obviously Center for Medicare and Medicaid Services has launched some new pages. You'll see on the links there, and what we're doing and how we're moving forward with that. Every quarter you get an opportunity to update your plan and submit it to the Center for Medicare and Medicaid Services about the American Rescue Plan, et cetera, et cetera. And obviously you can see more information here on those links. Next slide. So we remain committed to getting money out. And I believe that some people, if not all people, should have received some payments yesterday in your account. And this was the ARPA money that went out through PCI for people who billed in PCIS2. It was retro back until April, and obviously it's a 5.5% increase. And it was basically submitted based upon the claims that we had done, as you have given us your information, and you'll see an email going out because everybody did not certify attendance and or whatever. So we're asking you to go back because I don't want the providers to be leaving any money on the table. So if you didn't certify for a month or 2 weeks or whatever, please make sure that it's complete. And again, something will be going out shortly to say, please complete this and get it in. And I think it's about a 3-week window, somewhere around there, if you would, to make sure that we can get more money out to the providers. And then the last bullet talks about, in addition to that, 75% that we've talked about before that's going out for rates, there's additional money that'll be for grants. As you see, $50 million, and non-competitive grants and competitive grants for $10 million. And we're working on that right now, and that more information to come. Next slide. So obviously, the governor announced as an initiative to make sure boosters are out there, and Maryland has administered 280,000, as you see, and nearly 85% of our population, 12 and older, have at least one dose. So you can see this information, you can see the slides to click on from the governor's press conference on Monday. And again, a lot of boosters have gone out, and if you did have an opportunity to listen to that, you can see from the press conference the governor was talking about people can mix and match. So if you had Pfizer, you can get Moderna. If you had Moderna, you can get Pfizer, or it's people's choice. But just to get a booster is extremely important. We know that. Next slide. So following the CDC approval, Secretary Schrader announced about boosters, etc. And we've got on here where you can get an appointment with the 855 Maryland MD COVAX. And again, mix and match. And I just want to say that we've asked for some information about booster doses, and we've done fairly well early on with the approval. Hasn't been that far back about boosters and where we are. And I can tell you in the central region, there's about 195 people in services that have a booster. There's 8 in the East Shore, 112 in South, and 46 in West, for a total of 356. So, again, I'd ask people to continue to do that. Next slide. So DDA, and obviously we are looking at boosters and booster clinics and how we can move forward with assisting. Right now, we're going to start in the central region and work out the logistics to get to the other regions as we move forward, and basically have the agency send a booster clinic request form from the agency, etc. And also recognize that you can get your boosters hopefully through your healthcare providers or community pharmacies. So again, booster clinics are extremely important, and we will continue to work on that and assist people like the providers did really good job in hosting clinics, etc. And not just for the population that they provide support to, but also people who were self-directing and people who were just at home. So thank you. Next slide. So again, thanks to everybody for all that you do, the leadership you've been doing, and again, the clinics and the number of people that have been vaccinated. So I want to just give you some regional updates about where we are. And as of the 26th, 3 days ago, Central Region had 978 confirmed positives and 57 deaths. East had 190 confirmed positives and 7 deaths. South Region 671 confirmed positive and 29 deaths, and the West has had 409 confirmed positives and 20 deaths. And then, when we look at our direct support staff, the South has 444 positives and 5 people have passed away. West 239 and 2 deaths. East 324 positive and 3 deaths. And then Central is 748 positive and 2 deaths. Staff. So, again, we pray for everybody and continue to assist people and work collaboratively together during this difficult time. So, anyway, next slide, please. So this is again the 26th, the week ending, and you see the pie chart on the left is our participants, which is basically 17,764. And you can see that of the people tested is about 12% have tested positive, or 2,362. You notice the chart on the right is basically from July through October 26th, and it drills down the numbers of positive. And this has just been an update because we didn't have a webinar in September, but we did, our last webinar was in August. So again, you see some increases of positives, etc., like 67, and I'm not going to read it because you see them on the bottom right-hand side of the slide towards the bottom, illustrating the actual numbers. So again, it's important to think about still, even though you're vaccinated or have a booster, about social distancing, masking, etc. So next slide. So this chart, one we've been doing right along also, and it shows that again, we had 9 participants who had passed away since our last webinar. And this is data from July 27th, and the pie chart on the right, that there's been 114 participants that have passed away. Again, this is not good news but I think it's important that you get the update. Next slide. And so this is about the self-direction. We've been doing this as a separate slide for quite a few presentation webinars now. And you can see we've got 46 people in self-direction that have tested positive. And this is the first time that I believe we're reporting that there have been any deaths. And there's been 2 deaths since our last report. Next slide. So in reference to vaccination tracking, again, of our participants, we've got a good percentage here of 92% vaccinated. 1,300 have not received any vaccine. And again, congratulations to everybody in working with the local health departments and the Walgreens and CVS, who are the federal partners, to do vaccinations, etc. Next slide. So this obviously is just showing numbers of family members, and I won't read it to you, but you can see that how many family members, administrative staff, direct support, and people who are self-directing participants. And what does that look like? And obviously there's been an increase, which I'll just note, of family members of 665, administrative staff a little over 500, direct support professionals 1973, and self-direction participants 106. So that's an increase since the last webinar of 3,250. And so that I think that's really great that people are going out and continuing to get vaccinated, and looking at the boosters as we talked early on in this webinar. Next slide. So again, I want everybody to remember that we're doing these monthly. I do apologize for last month that I had a conflict and we could not kept a webinar because of conflicts that we were rescheduled, and I didn't want to reschedule. I just thought that we could, postpone, since we did start doing these weekly and then went to every other week, and now we do these monthly. And again, everybody knows what we're going to talk about with some of these slides, and knowing that vaccinations are extremely important, and now having a discussion about boosters. So this slide has a link that you can share with your colleagues, families, and about registering for our upcoming webinars on November 19th and December 17th. With that concludes my presentation, and I think we are ready to take any questions.
Hi, yes, Bernie, we have some questions for you, for Robert, and for Rhonda Workman. So I'll start with you, Bernie. And the first one is, what is your target date to complete the rate study? I heard November.
Well, we're engaged with, it's not just DDA, we're engaged with outside entities like Max, and having discussion about the rates. So, I mean, there's been ongoing meetings, there's some upcoming meetings. I think everybody is anxious to get the budgeted rates completed. And so I don't know if I have a hard, fast date. I do rely on, again, the Max group, as well as, our actuaries for the department, Optimus, and moving forward, I can tell you that there's some upcoming meetings, and I think we're extremely close.
Okay, and the next one is, will there be additional providers starting on 1/1/22 or 3/1/22 in LTSS, Maryland?
I don't think the implementation strategy is final. I think we've got to do the rates first, and then once the budgeted rates are completed, we are going to ask the providers to do an impact. I mean, that's always been an issue in discussion since we started the rate study about, you've got the rates, and then what's the impact on the providers. And then, as you know, we've got Senate Bill 796 that DDA has to report on, and I don't think we are anywhere solid about, well, what does the implementation strategy look like? There's still discussion. Are we going to start January 1? It's going to be a heavy lift to do that. I mean, we're going to be November next week, and then you've got the holidays coming up. So January 1 might be pushing it. I don't want anybody to feel pressure. I don't think you want to put pressure on yourself. So again, I think we need to continue to do this very thoughtfully and methodically, and what is the implementation glide path, for lack of a better term, look like.
Thank you, Bernie. I'm going to move over to Rhonda Workman. This one is in reference to Appendix K. So staffing and hiring of direct support professionals continue to be a huge problem. What will happen after December 31st, Appendix K has run out and people are sitting home because there are no staff to support people? There are providers that think that the virtual services added to the PCP will be sufficient for this issue, as written in Amendment 3. This wouldn't be an agency convenience. So Rhonda, before you answer that, can you give the two perspectives and points that providers and participants need to do in reference to the program service description and the service implementation plan?
Sure. Yes, Patricia. So a couple things that we have great opportunities to continue our virtual supports as a service delivery model for participants and families that choose that service model. Our providers have been very creative during COVID to create some very robust and interactive virtual support options. We encourage teams, though, to have that conversation with the participant and their family to identify the services and supports that best meet their needs. As providers are working diligently to address service needs of individuals and to reopen their programs, they will be considering these options and looking to continue to support participants and families based on the services and choices, including virtual support models that best meet their needs. So as we're unwinding from Appendix K, we know that our amendment number 3 provides the ability to provide virtual supports through our Meaningful Day and our personal support services. And so we want to make sure that that is the option that the participant would like to continue as we unwind, so starting in January. And what we're asking, as we noted on our slide today, is for the provider, if they're proposing to continue to provide virtual supports, to update their service implementation plan and provide that to the coordinator of community services. The coordinator of community services should then discuss and confirm with the participant and their family that that is part of the service provision that they are seeking. Therefore, it would not be based on the agency's convenience, but the participant and their family have the last say, the approval of that proposed service implementation plan. With their approval, the CCS will upload that into the client attachment, and therefore we will no longer need to do a revised person-centered plan. It's important for our providers to remember, as per our guidance issued in February for virtual supports, if they have not already, they need to update their program service plan and submit that to the DDA regional office. By submitting that plan by December 31st, providers will be allowed to continue to provide that service while the DDA is reviewing and doing the review and approval process.
That means that the review process will be retroactive to the day that you submit it. So you don't have to worry about rushing it through as long as the DA has it. Thanks, Rhonda. The next question is very little similar, but with more clarity. Do you mean that the residential provider can bill for 5 hours in the day or CDS for 1 hour of virtual, for example, for the same day as long as they don't overlap in time?
Yeah, so this is a really good question, and this question relates to individuals that are being supported in residential services, so in one of our group homes or residential services, and virtual supports are being proposed to be provided for Meaningful Day services. And in consultation with our Medicaid partners, it has been identified that we cannot provide virtual supports and Meaningful Day virtual supports and residential dedicated supports at the same time. Therefore, this question is can a residential provider bill for 5 hours of services and the Meaningful Day bill for 1 hour services, but at different times? The answer to that is yes, and that is what we have reflected on the slide.
Great, thank you, Rhonda. Robert, the next question is for you. Please clarify, will the 5.5% rate increase apply to LTSS bill services such as personal supports, and effective when? Robert, if you're talking, we cannot hear you.
Sorry.
Go ahead.
Thank you for the question. And so, we applied the 5.5% rate increase to the FDS services that are in PCIS 2, because, the secretary was committed to getting some money out to the providers to assist with, staffing issues and hopes to getting back to pre-pandemic levels, service levels, et cetera. We continue to work with MDH and Medicaid, looking at other opportunities. I know that the secretary touched on the grants that are also available as part of the ARPA. And so, that's as far as we've gotten up to this point. And any new information we'll get out as soon as possible.
Thank you, Robert. The next one is, our behavior support services included in the revenue that will receive the 5% increase?
Yes, the BSS claims, the qualified claims were included in the revenue that we use to calculate the 5.5% increase.
Great. And is the 5.5% an annual increase or a one-time only?
Yeah, that's a great question. So the 5.5% retroactive increase was a one-time only increase that will be sustained using the ARPA funds for the next 3 years. So if you can think about the base, I'm just going to throw a number out there. So if the base is, $1 million, and the 5.5% increase would then be added to that base, and then moving forward, sustain with ARPA. And so because it's part of that base, it will also be part of the calculation for the annual 4% COLAs.
Great, thank you. So the next one is, if we update our program service plan to include remote services, do we also need to update it to include the virtual services, Rhonda?
Yeah, so that's a great question. And so 2 things we want to clarify. Number 1, remote support services is a specific standalone waiver service that provides an alternative to direct support during the overnight hours. That differs from virtual supports, which is a service delivery model option compared to in-person for a meaningful day. So yes, if you're going to provide both remote support services and also want to provide virtual supports as a service delivery option for your meaningful day or personal supports, they need to be included and updated in your program service plan.
Thanks, Rhonda. Robert, this one is for you. Will LTSS develop more reports to allow an agency to generate a report to users' logins?
Yeah, great question. We're actually working with a group of consultants that Medicaid has engaged with on, looking at additional reporting functionality within LTSS. So I'll be sure that I keep this on my list as well as we continue those discussions.
Thanks, Robert. And this one is for you too. I received another provider's ARPA funds details instead of my own. What should I do?
Yeah, please forward that back to me so that I can have the team look into that.
I did. Okay, this one is, when will updated family as staff forms be ready? This provider will not pay after 12/31 if they don't have the forms. There is an old form, but some regional directors are waiting for the new forms.
Yeah, so that's a really good question. And this question relates to our self-directed service delivery model. Yesterday afternoon, after having a call with the Self-Directed Advocacy Network, they forward their feedback related to our proposed revised form. So we are going to review that and hope to get some communication out next week so that we can start to have that form being implemented.
Great. And Robert, this one is for you. Did we know how the additional ARPA funds will be distributed for remainder of the fiscal year? Will the 5.5% also be added to the July 1, 2022 rates moving forward?
Yes, the rates in PCIS 2 will be updated to reflect the 5.5%. And so the October, excuse me, through December payment will be reflected in the April advance.
Thank you. Here's another one, and this was about a virtual support. So Rhonda, I'm gonna leave this one to you. How will virtual day service providers be able to bill for 1 hour during the day when there's no possibility of doing that in the current PCIs 2?
Yeah, Andy, I think that's a good question that's being discussed at the secretary's level with the coalition that you're at the table with. Currently, you know, we have the flexibility through the Appendix K and the emergency regulations that are in place at this time.
All right, this one is about a 5.5 one, and it is I lost. Will the 5.5 increase be in PCIs 2 and LTSS starting October and moving forward? Robert?
Yeah, again, the 5.5% rate increase will be reflected in PCIS 2. We are talking about the logistics of that now. But yes, in PCIS 2, those rates will be increased, and so you'll see that reflected in your payments moving forward.
Great. Will there be an updated rate charts for FY21 and FY22 to reflect the 5.5 rate increase, Robert?
Yes. Yes, there will, you know, once we update the rates in PCIS 2, we'll have the updated rate charts and we'll get those posted.
Great, thank you. And the next one is, do we need to update our program service plan for virtual services only if we intend to continue them after Appendix K ends? And the answer is yes, please update them. Okay, and then the next one is, are all provisions of Appendix K where individuals can receive 30 additional COVID hours expire December 31, 21, are there exceptions? Rhonda?
Yeah, so that's a good question. I think this relates to the personal supports flexibility in our Appendix K, where the DDA may add some additional hours for personal supports. And, you know, through our presentations and in our guidance, we want to continue to emphasize the importance of person-centered planning and those teams discussions. So if personal supports or additional hours are needed, then that should be discussed now and a revised plan included if needed.
Okay, this one is for Robert. What is the timeline for payment for services submitted through the GAP claims process with LTSS for FY21?
I'm sorry, Patricia, could you please repeat the question? I'm trying to understand.
Sure. What is the timeline for payment for services submitted through the GAP claims process with LTSS for FY21?
Sure, I'll have to get back with them on that particular question.
Yeah, and I guess the same person is saying, for clarity on the ARPA question, you're saying that LTSS services will not receive the 5.5 rate increase at all?
No, what I said is that we're continuing to work with the Maryland Department of Health and Medicaid on, because this is all part of the budget language that was passed by the legislature for FY22. And so we're continuing to evaluate that. We're still waiting on the outcome of the ongoing work we're doing with the budgeted rates, et cetera. And we're just not prepared. We don't have a definitive answer at this point in time. But as soon as we, information is available, we'll be sure to get it pushed out. We know that everyone's anxious. So.
Okay, great. The next one is for you, Robert. For providers waiting for error reports processing, receive the 5.5 on this as well?
Okay, so the timelines that Bernie talked about, and as well as the timeline that is in the email that most of you may have received by now with the claim summaries that we used for the catch-up payments. If there's error updates that you all need to get in during the dates of services of April 1 and September 30th of 2021, if you get them in before that deadline, then it will then they will be pulled into the claims used for the second payment.
Thank you, Robert. This one's for you, Rhonda. There are still some issues with alignment between providers and CCS regarding personal PCP revisions, person center plans revisions. In a previous webinar, you indicated that if a provider has not submitted the service implementation plan, that they should be left off the plan so that other providers' billing is not disrupted. Is this still the practice that should be occurring?
Yeah, so that's a great question. And I know we've had different discussions previously related to webinars. And so really for the services to go forward, we had said that the service implementation plan for new referrals or annual referrals needs to be completed and included with the plan. What we're talking about today is unwinding strategy specifically to virtual supports. And for those participants that want to continue to have virtual supports as part of their service delivery option, that we're asking that the provider update their service implementation plan and provide it to the CCS so they can upload it in the client attachment versus doing a revised plan. So again, what we're talking about today is the unwinding strategy to avoid having everybody having to do a revised plan to include virtual supports. Instead, we're asking that people would do providers would do an update to the service implementation plan to be shared with the coordinator, who will then review it with the participant and their family to make sure that that is their choice. And then that would be uploaded into the client attachment.
Thank you, Rhonda. There's one question in reference to the unwinding. After January, can you still bill 1 hour for the whole day?
So as we've mentioned, previous question that came in, currently the ability to provide 1 hour of service and bill for the full day. We've got the unwinding going through, I believe it's December 31st, and emergency regulations were issued to support that opportunity to continue temporarily.
Thank you, Rhonda. The other clarifications, PCP process and LTSS are generally. So right now we have all the PCPs live in LTSS and providers get paid through PCIs too. So we really want to make sure that you align some of those services in reference to the meaningful day services. Then the next question is another virtual supports, Rhonda. The virtual supports memo also mentions policies and procedures as required for approval.
Yes, that's a great point. So as the virtual supports memo indicates, which is on our website and available by contacting the regional office, it says if you're going to add virtual supports as a service delivery model, you need to update your program service plan and also include policies and procedures specifically related to the virtual supports. You'll see in the memo that we're looking for your policies and procedures to protect people's rights to privacy and opportunities for integration. And so the memo specifically outlines requirements that should be documented and updated in your policies and procedures.
So do providers have until December 31st to update each participant's service implementation plan for the virtual support services delivery model? Or can this just happen at their annual PCP? Does the same go for the shared dedicated hour service delivery model?
Yeah, that's a great question. And what we're trying to do is have the information updated by December 31st so that we have that in the plan as required by our federally approved program. And as opposed again to having to do revised plans, PCPs for everybody, we're asking for that to be updated in your service implementation plan, shared with the coordinator, who will share with the participant and the family to ensure that is their choice, and then uploaded into the client attachment.
Thank you, Rhonda. We have 1 minute left, and I just wanted you to know, as Bernie, or Deputy Secretary stated, and is in the presentation, we update the frequently asked questions on a regular basis, and the link is in this presentation. So if we didn't get to your question, we are going to upload it, answer it, and then update the FAQs. So Bernie, I'm going to turn this back to you.
All right, well, I want to thank everybody. I mean, we've had a great turnout today. We had over 500 people. We've had a few people who have left, but you know, again, I want to thank you for your support, all the work that you do, and more importantly, the continued partnership that we have, you know, with the providers, individuals, families, people who are self-directing, et cetera. I mean, I think that this is really a strong way to continue to move forward to increase and be responsive to the people and what the request is, what the needs are, et cetera. So again, be safe, please stay dry, and thank you again for participating today.